Hi, my name is Carly Lassiter, and I'm going to be talking to you about occupational therapy in Parkinson's disease. So a little bit about me. I have a bachelor's degree in kinesiology and sports studies from Texas A&M University Commerce. Currently, I am a graduate student at Texas Women's University, Dallas, in their entry-level Doctor of Occupational Therapy program. I will be graduating this May of 2023. And in my last semester of the program, we complete a capstone project, and I am completing my capstone project at DAPS. I will talk more about details at the end of this presentation. So I wanted to give you a chance to think to yourself what you think occupational therapy is. Reflect on your experiences if you have received occupational therapy, or maybe if you're unsure what occupational therapy is, I am going to describe it. So occupational therapy is using everyday life occupations therapeutically to support performance and participation. Clients in occupational therapy can be an individual person. It can be completed in a group or also given to an entire population. Occupational therapists strive to promote meaningful participation in occupations to support one's overall health and well-being. So simply stating that occupational therapy is really here to promote your meaningful participation in daily occupations. And then an overarching statement describing occupational therapy is achieving health, well-being, and participation in life through engagement in occupation. This statement really describes the domain and process of occupational therapy. So what are occupations? Sometimes when you hear the word occupation, you might think of your job, but occupations can be so many more activities. Several activities are considered occupations. Occupations are daily activities that occupy our time. They fill our days. They are things that we want to do and need to do throughout our day. And doing these daily activities or occupations also brings purpose and meaning to one's life. So here are some occupation examples. We participate in occupations every day. Occupations can range from simple activities to more complex activities. And here is a list, a comprehensive list of occupations that occupational therapists can evaluate and create intervention plans for. So I'm just going to take a few minutes to kind of go through the list of what falls into or is considered an occupation. So starting off, we have self-care activities. In OT, we call these activities of daily living, and these are more simple activities, things like showering, getting dressed, eating, going to the restroom, also walking. Your functional mobility is a self-care activity. Then we get into a little bit more complex activities. These are activities that support your daily life. These are instrumental. These can be things like cooking, cleaning your house, shopping, grocery shopping, driving your car, religious exploration, and also taking care of others. If you are a parent, that is an activity that supports daily life. Another occupation is managing your health. This is really self-management. So medication management. In occupational therapy, we can help you create a medication schedule and make sure you are taking your medicines by the label. A physical activity can be considered an occupation. We know that in Parkinson's disease, exercise is very important, and it does help reduce various Parkinson's-related symptoms. Nutrition is also an occupation. And then also managing your symptoms related to your condition falls into this category. Rest and sleep are also considered an occupation. This would be sleep hygiene, so making sure that you have a good sleep schedule. Your education, learning, college. If you are learning something right now in this presentation, that could be considered an occupation. Working, so your job is an occupation, but it's not the only one. For children, we have playing. Playing can be considered an occupation. And then as we age, our leisure activities and our hobbies. And then also socializing with your friends and family. So as you can see, occupations are a pretty comprehensive list, and these activities really fill our days. So how do occupational therapists carry out evaluations and interventions? Occupational therapists treat patients across the lifespan and work in a variety of settings. OTs can work in hospitals, inpatient rehabilitation facilities, which is a facility where you would receive OT, PT, speech therapy. You might go there after you discharge from a hospital, or if you've had a surgery and need therapy. OTs can work in skilled nursing facilities, home health, where a therapist comes to your house to administer services, outpatient clinics, where you would go to a clinic in your town or area to receive occupational therapy. And then for children, OTs can work in the school system, and there are also a few other settings. So OTs are qualified health professionals. They use their clinical reasoning skills and professional judgment when evaluating a client's performance challenges. So when an occupational therapist completes an initial eval, they're going to look at the performance challenges you are having in those daily activities that we just talked about. But they're also going to consider your individual interests, what beliefs you have, your daily routine and how that may impact the way you complete activities, what habits you have, your physical skills, which could be your range of motion and your strength, your cognitive skills, so things like memory, problem solving, executive functioning, which is a higher level skill, and then also the context that the occupation takes place in. So this means that they're going to look at your environment as well. So it is a pretty holistic, well-rounded. Occupational therapists are going to look at you and also your environment and how that can impact the challenges you are facing. And then they will use all of that information to create occupation and evidence-based intervention plans. So here are some Parkinson's related symptoms. Parkinson's is a neurodegenerative disorder caused by a lack of dopamine in the brain. Some of the common motor symptoms is a tremor, which is typically one of the first signs. Rigidity, which is stiffness throughout your joints. Bradykinesia, which is slowness of movement. And postural instability, which is difficulty balancing or impaired balance. Parkinson's also has non-motor symptoms as well. So this is autonomic dysfunction, constipation, issues with your bladder and temperature regulation as well. Cognitive impairment or cognitive decline as your symptoms progress. Fatigue is a major non-motor symptom. Anxiety and depression, sleep disturbances, which may be difficulty falling asleep or difficulty staying asleep. And then reduced smell, which is actually one of the first early signs of Parkinson's disease. So in preparing for this presentation, I looked into some updated statistics listed by the Parkinson's Foundation. Parkinson's disease is the second most common neurodegenerative disease. It is behind Alzheimer's. Around 1 million people are living with Parkinson's disease in the United States. And interestingly, around 52,000 people are living with Parkinson's in Texas alone. And then Parkinson's Foundation did a study in 2022, and it revealed that 90,000 individuals are diagnosed with PD each year. This is important to note because it is a 50% increase from the previous rate. So more individuals are being diagnosed with Parkinson's disease. Hopefully, as more diagnoses are being made, more research will be conducted about the different Parkinson's symptoms and how we can manage those symptoms. So the Hone and Yar stages are used clinically to measure how PD progresses and the features related into each stage, the level of disability. So I'm just going to recap each stage and kind of talk to you about the features. So in stage 1, your symptoms could be very mild, typically on one side, and they're not disabling. An example of this could just be a tremor. Stage 1 typically responds to medication well, and you may be in this stage for several years. Stage 2 is when you get midline and both side involvement, which means bilateral. You have mild issues with trunk mobility, so reaching, bending, things like that, but you're not really having any issues with your balance quite yet. In stage 3, which is mild to moderate functional disability, so you may begin to demonstrate some deficits functionally completing daily activities. And this is also when you may begin to experience some balance instability or issues with your gait, difficulty maintaining your balance. Stage 4, disability begins to increase. You have more difficulty with your balance. Your symptoms may interfere with self-care tasks. So this could be things like showering, dressing, eating, like we had talked about. And then you may also begin to experience decreased fine motor skills. Fine motor skills in occupational therapy just means manipulating small items. It could also be your grip strength. So as your symptoms progress, you are beginning to have difficulties manipulating items, holding utensils, and then also your grip strength may decrease. And then stage 5 is when your symptoms are progressing and you are really needing help with those self-care tasks. So these are some specific Parkinson's disease assessments. These are clinical assessments used for Parkinson's disease. The Unified Parkinson's Disease Rating Scale measures the extent of Parkinson's symptoms. And then the next bullet, the PDQ-8 and the PDQ-9 measures self-perceived quality of life. And then the PD-ADL, Activity of Daily Living Scale, measures your perception of performance in activities of daily living, which are those basic tasks, showering, dressing, eating, and so on. So take a moment to reflect and think if you have received or if your doctors have given you any of these assessments. If not, you might have not realized that your doctor was asking you questions related to these, but these are assessments that healthcare providers can use to track your change in symptoms, change in quality of life, and also the way you perceive your activities of daily living. So what is occupational therapy's role in treating individuals with Parkinson's disease in the early stages? So due to the progressive nature of this disease, one's quality of life, level of independence, and your ability to participate in those important daily activities can be impacted. You may experience some symptoms early on, and they may progress as the disease progresses, the stages that we just discussed. OTs really focus on physical, cognitive, and social emotional needs. So they're going to look at the whole picture. And really in the early stages, occupational therapy focuses on self-management, promoting participation in desired roles and activities, and enhancing performance in those activities. So this just means occupational therapy is really working on and promoting your continued independence and participating in activities that are important to you. It is important to note that occupational therapy is not always commonly indicated in the early stages, but it still can be very beneficial. So here are some common interventions that OTs may work on and address in the early stages. So the first one is education on the disease process or self-management. So teaching you about the disease and how you can self-manage your symptoms. Occupational therapists can help identify community resources to help you learn more about the disease and be able to work with your community and just have resources available to you. DAPS is a great example of a community resource. Another common intervention in the early stage is daily exercise and stretching. Stretching to kind of reduce that rigidity and stiffness, and then daily exercise is very important. Research has shown that daily exercise does help, keep you healthy and reduce some Parkinson's symptoms. And then for individualized treatment, occupational therapists will work on increasing your strength, increasing your overall endurance, and also work on your balance. Energy conservation is a common intervention. This is specifically for fatigue. So an occupational therapist can teach you different energy conserving strategies to help you still complete activities if you are experiencing fatigue. And then another one is work and home modifications. So an occupational therapist can observe you at your job and the duties that you need to perform. And then also your home, they can come and assess your home. They can recommend different safety modifications that you may need in your house to, increase your independence and make sure you're being safe, and same for your work. They can recommend different changes that will promote your independence and your continued performance in those activities. But the main goal of work and home modifications is that in the early stages, we may need to begin changing your environment to increase your independence. So occupational therapy's role in mid to late stages. So occupational therapy is commonly indicated in mid to late stages as your disease begins to progress. Occupational therapy in these stages is really working on adapting and compensating activities to maintain your engagement and your overall independence. So we are having to make some changes in the way you perform activities. So I'm just going to go through some common interventions at this stage. Medication management. So I'd already kind of briefly talked about a schedule, but an occupational therapist can help you create a medication schedule around the daily activities that you're performing. Make sure you're taking your medication at the correct times so that you can continue to go out and about throughout your day. They can make sure that you are taking your medications by prescription and also help you set reminders to make sure that you are taking your medication on schedule. We know that taking your medication scheduled in normal times of the day is very important. The consistency is important for Parkinson's disease. More energy conservation and work simplification. So if you are experiencing increased fatigue in the mid to late stages, occupational therapists can teach you strategies for fatigue management. These will help you conserve your energy and can also make tasks easier. Using adaptive equipment and assistive technology. These could be things like built-up handles on utensils, installing grab bars in your house for safety, sitting in a shower chair, and many types of dressing equipment. An occupational therapist, after completing your initial evaluation, can recommend different types of adaptive equipment they feel you might need. And I have pictures on the following slides to show you some of these. Excuse me. The next is dysphagia interventions. If you are maybe having a hard time swallowing, Occupational therapy can play a role in helping your swallowing and working on some interventions. We can work collaboratively with your speech therapist to make sure that your swallow is safe. A big one is reducing fall risk. So this goes into that home assessment. An occupational therapist can come into your home and do a comprehensive evaluation to recommend removing tripping hazards, and they're going to recommend setting up your environment for safety. It is really important to reduce fall risk as the disease progresses, and to help keep you safer, especially in your home. Your home needs to be a safe place for you. Another important one is transfer training. So this is really focusing on how to safely and effectively transfer from one surface to another. So if you were in a wheelchair, how to safely transfer from your bed to your wheelchair, or how to safely maybe transfer from a wheelchair to a toilet. Even if you are ambulatory, if you're walking, how to safely get into your shower, how to step over the ledge of your bathtub. If you were using a walker, how to get your walker into your bathroom to take a shower. Thinking of going from one surface to another safely and effectively. An occupational therapist can help practice transfers and give you tips to do the steps of a transfer safely. And this kind of goes into caregiver education as well. An occupational therapist can work with your caregiver or care partner to teach them how to safely assist you in transfers and how to safely and effectively help you complete those daily activities that are important to you if you are needing more assistance to complete those. So here are some pictures of adaptive equipment like I talked about. On the left, you will see utensils with built-up handles. These make it easier, the built-up handles make it easier to hold the utensils. As I mentioned in stage 4, stage 3 to 4, you may begin experiencing some fine motor difficulties, and holding smaller items can become difficult. So using built-up handles can make it easier to eat during dinner. In the top right, we have a spoon specifically made for individuals with Parkinson's disease. If you are tremor dominant, this spoon kind of helps move with your tremor. So the area where the actual spoon metal part is moves like this, kind of helps negate your tremor. So when you're scooping, not as much food will fall off your spoon, and it'll make eating more effective and not take as long. So this is a spoon specifically used for Parkinson's patients. And then we also have a scoop dish in the bottom right, the red plate. As you can see, there's kind of a lip around the plate. And what this is, helps scooping food onto your spoon easier. So what you do is scoop your spoon to that little lid, and the lid helps push the food onto your spoon. Just makes eating more efficient. Here are some more examples. So in the top left is a shower bench. This makes transferring into the tub easier. So you can sit on the bench and swivel your legs in without having to step over. And then you can also sit on it to take a shower to help conserve energy. Below that is a sock aid. If you have not used a sock aid, it is a very handy tool to help you put on socks without having to bend over. If you are experiencing some difficulties with trunk mobility or your balance and you're having a hard time bending over, you can use a sock aid. So you place the tip of your sock on the plastic, you put it on the ground, and you use the ropes to pull your sock on your foot. It helps you not have to bend down. In the top right, we have a reacher. A reacher can be used to grab things low on the ground or high. If you're having some difficulty with trunk mobility or stiffness in your joints and it's hard to reach high, a reacher can be a very handy tool to help you gather things in your environment, especially if you are having a hard time bending down. It can also help with your safety. And then below that, we have a built-up handle for a pen. Some individuals with Parkinson's may experience micrographia, which is just very small handwriting. And especially if you're experiencing some difficulty with your fine motor skills, gripping can become hard. So putting a built-up handle on a pen can make writing and holding a utensil easier. This is just a few examples of adaptive equipment, but there are many other types of adaptive equipment. Like I mentioned, if you are to receive OT services, your OT will give you a very comprehensive evaluation and recommend what adaptive equipment, if any, you might need based on the challenges you are experiencing. So LSVT Big. Again, I want to encourage you to think if you have received LSVT Big or if you have heard of it before. So occupational therapists can be certified in LSVT Big. They can lead this intervention and they can be LSVT Big clinicians. So LSVT is a 4-week program with one-on-one sessions. And then once you finish the program, you will continue daily exercises in this curriculum. So the goals of LSVT Big is to increase the size and amplitude of movements and help participants realize when movements are slow and small. So in this program, you are going to do exercises that really focus on big movements. And the goal is doing these exercises large and big will help carry over into your home life, doing daily activities, help promote those larger movements instead of keeping things small and things like that. So the goal is to complete these big movements and help them carry over into your daily life. And then on the LSVT Big website, they stated that research has shown improvements in faster walking with bigger steps, improved balance, and increased trunk mobility. So these are all skills that can make completing daily activities a lot easier. So how to receive occupational therapy services. So consult with your neurologist, your movement specialist, or primary care physician. You can talk about your symptoms that you're facing, and if they feel that you would benefit from occupational therapy services, they can write you a referral to a licensed occupational therapist. So once the OT receives a referral from your doctor, they will complete your initial evaluation, but they need a referral to do that. So it is important to advocate for yourself when you're having those conversations with your doctor. Talk to your doctor about the challenges that you are experiencing during daily activities. If you're, having difficulty getting dressed, or if it's taking longer to complete activities, or if you're experiencing fatigue throughout your day and maybe you aren't cooking as much, or you're having difficulty grocery shopping and driving is getting more difficult, all of those very activities that we complete every day, those are becoming difficult. Talk to your doctor and ask them about occupational therapy. Then discuss what setting is right for you. This can be a conversation you have with your doctor. If you feel like that, you do not have transportation, or your symptoms are very severe and you're not able to get out, your doctor may recommend home health. Outpatient is an option as well. So have those conversations with your doctor about the symptoms and the difficulties that you're facing in daily activities. So current literature. This kind of is leading into my capstone project. So this summer, when I started my capstone project, I had to do a literature review. So just combing through the literature out there about Parkinson's disease. So here are some of the prominent themes and studies that I found. According to the Parkinson's Foundation, fatigue has been identified as an unmet need. So this means that they pulled a large group of individuals with Parkinson's, and they stated that fatigue is an unmet need. Research from 2 different studies have shown that individuals with Parkinson's disease demonstrate deficits in IADL performance. Those are those more complex daily activities. I believe specifically in this study, it was grocery shopping, showering, cutting food. So deficits in IADL performance and have lower quality of life scores. 2 different studies have stated that. And then another study kind of revealed that little is known regarding the mechanism of fatigue in Parkinson's disease, along with a lack of effective treatment. So this just means that it's kind of hard to pinpoint what is causing fatigue. It might be different for each individual. It could be maybe you're having an off period with your medication, could be related to apathy. So there are different reasons why you may be experiencing fatigue. And because of that, there's really a lack of effective treatment. And then that same study, based on the participants, stated that fatigue is often perceived by individuals with PD as one of the most disabling symptoms that has the greatest impact on their quality of life. And then a different study stated that the presence of fatigue in their participants was linked with higher depression levels and sleep disturbances. So reviewing this literature, I discovered that there is really a gap in fatigue management for Parkinson's disease. A lot of the literature out there is regarding fatigue management for multiple sclerosis, which is another neurological condition. But when looking into it, I didn't find too much about fatigue specifically related to Parkinson's. So this kind of led me into my capstone project. I'm going to be creating some educational resources and educational programming for fatigue management, specifically for different daily activities. I will be creating a manual for DAPS, and it's really going to hone in on energy conservation and work simplification based on occupational therapy principles. So I'm very excited to, be working on my capstone project and hopefully serving the DAPS's members to help if you are experiencing fatigue as your symptom. So these are just some references that I have found, but I want to thank you for listening to my presentation, and I hope you have learned a little bit about occupational therapy and the role that OT plays with Parkinson's disease. Thank you.